At this point in time, there's a lot of unknown when it comes to long-haul symptoms after somebody has an infection with COVID. We know some people have very minimal symptoms of COVID and for whatever reason they develop long-haul symptoms, and others are extremely ill in an ICU for months and then they recover and do quite well without any long-term symptoms. So what we plan to do is study almost everybody who's had a positive COVID test, try to reach out to them, find out what risk factors they had, if they have residual symptoms that could be long-haul symptoms, and to try to add to the knowledge base that's being done worldwide in terms of what causes long-haul symptoms, how long does it take to recover, what's the average time and duration, and is there anything that's been tried that can help improve or hasten the recovery? Because obviously we know the impact could be tremendous. We know that anywhere from 20 to 50% of people who've had COVID could potentially have long-haul symptoms. And depending on how severe those symptoms are, you could be dealing with significant rehabilitation services and other healthcare resources that are going to be needed to help us recover from this. So the more information we have, the better, and the better prepared we are, the better for patients, obviously, to help them recover as quickly as they can.
So when I came out of my being under, I was a stone. Even you can't swallow. You got the tubes feeding you. Took me like a month to start. They train you how to do exercises with your tongue and your throat, your esophagus. Finally, to get some just liquid fluids until they took out my tubes, and then you have to do more exercising until you can get to solid foods. So it was a long process, and you can't get out of bed because you can't walk no more. So it was like being a baby. I had to learn almost everything, and the worst thing was my shoulders and arms. And so when I came out, I was like this, stuck. And slowly, from Met, I went to Tape 4 for 6 weeks. It's more of a rehabilitation hospital. And took 8 weeks there, and now I'm on my 6th week. That was everyday therapy. And now I'm on every other day therapy at the hospital for 2 hours a day. And they finally got my hands moving. The pain is still there. It keeps going through your body. And my toes, and all my toes, and from my ankles to my toes. It's like, how do I explain it? When something goes to sleep, probably felt that, with some extra pain. So you get the pain, and they're always numb. But I can walk, not great yet. These were the most because I'm a painter. I like doing portraits, pencil portraits of pictures. I've been a carpenter for my first 20 years of my life. Then I went back to school and became a civil engineering technologist. So I love building too. I'm a guitar player. I play the drums. I play piano. I play bass. I can't do any of that. And that's what kind of a depressing and emotional thing. It's getting better. Like I said, you're lucky you see me after five months of this, and things are getting better. I'm not using my walker. I don't, in the house anyway, I don't use my sticks, but when I go out I do use it because I get tired after 5 minutes of standing, say, and you don't want to collapse, but the sticks help. I didn't realize that the aftermath, what this COVID could do. Like, we're all here like yourself, we wear a mask, we respect everybody, but you just don't imagine what it does.
13 months ago, when I was diagnosed with COVID, there wasn't a lot of information out there, and there were not a lot of cases. There weren't people that I could reach out to ask questions. So today we know a lot more. We've learned a lot more, and I would suggest people reach out perhaps to someone who's had it to get that support. Reach out to your doctor. I had Dr. Mazzotti. He was excellent. He gave me a lot of great advice, and make sure that you do get that advice. And like I said, they know more today, so that's the great thing. It's something that you've never experienced, not many people have. You're tired, you're fatigued, you feel very alone. So I felt very supported by Dr. Mazzotti, and that's really what got me through, and it's given me a lot of hope, and I'm feeling much better today.
This is just one of those things. It's an evolving situation. We have not seen this sort of occurrence in other viruses. We haven't seen it impact individuals this long after. So we really don't know the full impact of it, and we probably won't know until 3 to 5 years from now, when we truly understand what is that sort of sequelae of events that occurs in individuals, and how do we best intervene early and intervene the most effectively as well.